If you are struggling with a substance abuse disorder, taking the first step to get help can be a challenging one. Gateway Foundation is here when you need it. I spoke with Chief Clinical Officer Jim Scarpace about their outpatient services for treatment.
Gateway is one of the largest not-for-profit substance use disorder providers in Illinois, and we have a whole continuum of treatment services for patients that may be struggling with alcohol or other substances. We have a residential program, and that's where patients stay with us 24/7 for a period of time, and really gives them an opportunity to step away from some of the people, places, and things that may be contributing to their substance use disorder, and really helps us to help them stabilize some of the issues associated with their illness, whether it be from a medication perspective or a treatment perspective. But we also have a whole continuum of outpatient services, and those services are really geared for patients that may have work or school commitments and still need assistance with treatment, but can't be in a program 24/7 or for multiple days at a time.
So how does outpatient work? I mean, how does the care work? And then what do you do if you have co-occurring issues?
So outpatient has some different levels of care. It really starts with a comprehensive assessment to determine what level of outpatient care would best meet the individual recovery goals of the people we serve. And so we have programs that are 6 hours a day, programs that are 3 hours a day, programs that may be an hour to hour and a half a day, a few times a week. It really depends on the individual needs of the person. The programs are really set up around individual therapy, group therapy, access to our medical team to address medication needs for both substance use and mental health disorders, as well as making sure we involve family and support systems in that process as well. And it's great because it gives people an opportunity to get the treatment they need, but still attend to their family and other responsibilities they have in the community.
How does somebody know if they're right for outpatient or residential care?
I think an assessment, first and foremost, will help them make that determination. Even for someone that might need a higher level of care like residential, if their circumstances are such where they're not able to commit to that at this point, Gateway will work with them through an outpatient program to at least put the foundation in place to help them address their issues.
I know for a lot of people, just personal privacy is an issue, so outpatient seems like it would be the best way to go in that situation.
Yes, and in addition to our outpatient face-to-face programs, we also have an outpatient virtual program. So for those people who can't get to our treatment centers across the state of Illinois, we could set them up with a virtual outpatient program where they're connected to a therapist and our medical team to address those same issues, medications and counseling, but from the comfort and privacy of their own home.
Are your outcomes generally similar for both residential and outpatient?
Yes, as long as there's consistent participation from the individual. I think as we've talked about in the past, there's such a stigma around substance use disorder that sometimes it's hard for individuals to come forward and really seek the treatment they need. But what's most important is if you start to experience negative consequences tied to your day-to-day or your relationships as a result of alcohol and other substances, Gateway has a program that can work for you.
Was the saying go, you got to work the program to let the program work for you?
Yeah, yes.
Yeah. So how do people get started?
So first thing is to reach out. We have a website, gatewayfoundation.org, that will walk you through all the different outpatient programs as well as our virtual program that's available to you in addition to our residential. Or they could call our 24-hour call center, which is 877-505-4673 or 877-505-HOPE. And that individual on the other end of the phone can help them get connected to a program that's right for them.
And I imagine in the intake and the initial interviews, you could say to someone, we really do recommend residential more for you than outpatient if you're going to have a better outcome.
Yes, and even if you're not sure, you're like, I'm not sure if I could do residential because of the responsibilities I have with my family and with my job, reach out. Let us walk you through it. Let's look at the best option for you. And if outpatient is where we start, then we want to support you in that.
If you or someone you know is struggling with addiction, you can reach out to Gateway Foundation. The number is on your screen or find them online at gatewayfoundation.org.